Let's talk about Botox and how it actually works. Wrinkles have become a common concern for many individuals as they age. Luckily, we're an aesthetics doc, and there are various procedures to actually help today to erase wrinkles and give you that youthful glow again. One popular method that's been around for many years is Botox. Botox injections have transformed the cosmetic world, and many individuals rely on them to keep their skin looking firm, fresh, and wrinkle-free. In this YouTube video, we're going to discuss everything about Botox injections, from understanding how they work to their efficacy. So let's dive in. Before you decide to have Botox injections, it is essential to have a consultation with a qualified provider. During the consultation, you will fill out an encounter form that helps with the provider to understand your medical history. The provider will then engage you in a conversation and to understand your primary needs and concerns and what areas you want to treat. This is because Botox injections are not only used for cosmetic purposes, but also treating various medical conditions. We use them for ED, headaches, and a bunch of other things at Genesis. Additionally, during the consultations, the provider will inform you about the risk factors and the potential side effects of Botox, of which there are very little risk factors. Botox injections are performed by injecting a small amount of botulinum toxin into the muscle of a targeted area. So typically, the injections start between the eyebrows, then they can move outward, the forehead, around the eyes. However, you can also use them for the jawline, as well as other parts of the body and the neck. It only takes a few minutes to complete, and usually the injections with a very small needle, so there's minimal discomfort. After the injections, it's necessary to use ice to reduce swelling sometimes, but usually not. Many providers use ice, however, as an essential post-injection care. If you apply ice to the affected area after receiving an injection, it's obviously going to reduce inflammation and alleviate pain, but you shouldn't have much pain after Botox anyways. The results of Botox injections aren't immediate. They take up to 2 weeks to start to become visible, and the duration varies amongst individuals. So it can typically last between 3 to 6 months in a bell-like curve. So it's going to take a little bit, have a maximum amount, probably around 2 to 3 months, and then start to fall off again. But it's great, unlike other wrinkle-reducing procedures such as fillers or surgery that are permanent. Botox doesn't require any downtime, and you can resume activities almost immediately. Now, there's a bunch of myths and misconceptions around Botox injections. One is that Botox is dangerous and it's painful. Both of those are lies. Botox injections are very safe. They're FDA approved, they're minimally invasive, and it would take at least 100 vials of Botox injected into an IV to actually hurt you. The second one is that Botox completely freezes or stops any emotion whatsoever. If you're getting it done by the right person, you're still gonna have some movement and expressions. However, you're not gonna have all the wrinkles there. So you're gonna look more natural and young. We always recommend the sooner the better. Once you start wrinkle formation, that's the best time to get Botox and start it. So Botox injections are a safe and effective way to erase wrinkles and maintain radiant skin. So you want to make sure you're talking with your provider from beginning to end about what your results you want to achieve are and whether or not Botox is the right choice for you and your skin condition. So go ahead, feel free to reach out to us, get a consult, take the first step towards a smoother, wrinkle-free skin. If you have any questions on Botox, ask them below.